Migraine, Diagnosis, Symptoms, and Root Causes. Hello, my name is Dr. Rudrani Banik, and I'm a double board-certified neuro-ophthalmologist and functional medicine practitioner. Today I wanted to tackle a topic that affects over 1 billion people, migraine. This means that 1 in 8 people worldwide suffer from this debilitating condition. Migraine can occur in both adults and children. It's also 3 times more common in women than in men. The symptoms of migraine can be debilitating. According to the Global Burden of Disease Study, when it comes to years lived with disability, also known as YLD, migraine is the second leading disorder in the population. In the subset of younger women, it's number 1. Now, let's dive into the world of migraine by exploring its underlying pathophysiology, diagnostic criteria, symptoms, and root causes. At the end of this video, I'll also touch briefly on the management of migraine using a functional medicine approach. First, it is important to recognize that migraine isn't just a severe headache. Rather, it's a complex neurological disorder. Migraine affects both neurons and blood vessels in the brain. A migraine is believed to begin with electrical changes in neurons, a phenomenon called cortical spreading depression. These electrical changes are typically followed by changes in blood vessel size, along with an inflammatory component. To diagnose migraine, certain criteria need to be met. According to the International Classification of Headache Disorders, a patient is diagnosed with migraine if they experience recurrent headaches that last between 4 to 72 hours and they meet specific criteria. These criteria include 2 of the following 4 characteristics. 1, a throbbing or pulsating quality to the pain. 2, unilateral symptoms. 3, pain that is moderate to severe in intensity. And 4, symptoms that hinder daily activities. In addition, 1 of the following 2 conditions must be met. 1, sensitivity to light and/or sound. 2, nausea and/or vomiting. For the formal diagnosis of migraine, a person must experience at least 5 episodes meeting these criteria. As you can see, migraine has very unique characteristics. Understanding these criteria helps healthcare professionals differentiate migraine from other types of headache disorders and initiate appropriate management strategies. The myriad of migraine symptoms. While the hallmark of migraine is undoubtedly severe headache, it's crucial to recognize that the spectrum of migraine symptoms is vast and can extend far beyond head pain. There can be over 40 associated manifestations of migraine, some of which include yawning, flushing, gastrointestinal symptoms, dizziness, and even cognitive changes. These symptoms often form a distinctive pattern throughout the 4 phases of a migraine attack: the prodrome, aura, headache, and postdrome. A prodrome phase may precede the headache, characterized by increased sleepiness, fatigue, and irritability. Next, some individuals may experience migraine aura, distinctive visual, sensory, or language disturbances that occur before the pain sets in. Following the headache phase of a migraine, a postdrome or migraine hangover phase may linger, causing fatigue, difficulty concentrating, body aches, and sensitivity to light. Migraine can be mysterious. Recognizing this range of symptoms and phases is crucial for a comprehensive understanding and effective management. The migraine threshold. Now, let's talk about the fascinating concept of the migraine threshold. The migraine threshold is the point at which a migraine attack may occur, like a tipping point. For example, a lower threshold means that a person is more predisposed to migraine and thus more likely to experience an attack. Conversely, a higher migraine threshold means that a person is less predisposed to migraine and less likely to develop a migraine attack. The threshold is based on a person's genetics combined with their internal and external environment. What is important to remember is that an individual's migraine threshold is dynamic and can change. When considering the root cause of migraine, genetics play a major role. There were over 180 different genetic variants, some of which are short nucleotide polymorphisms, also known as SNPs, that have been associated with migraine. Some of these genes have been linked to sodium-potassium channels in the cell membrane and ATP production. Others have been associated with smooth muscle in blood vessels, and still others with the inflammatory cascade. However, what most of these migraine genes do is not clearly understood. Though a person's genetic profile may confer susceptibility to migraine, it is not the sole determinant. Research suggests that environment, lifestyle, and stressors can activate or deactivate these genetic factors. Aside from a genetic predisposition, let's explore some other internal and external factors that are linked to migraine. Internal factors like hormonal fluctuations, neurotransmitter imbalances, and inflammation can contribute to lowering the migraine threshold. For instance, hormonal changes in women during their menstrual cycle or during perimenopause and menopause can act as triggers. Falling estrogen levels are often implicated. Neurotransmitter imbalances are also believed to play a significant role in lowering the migraine threshold, making the brain more susceptible to these debilitating attacks. Research has highlighted the involvement of serotonin and dopamine in the intricate web of migraine pathology. Serotonin, known for its mood-regulating properties, also plays a crucial role in modulating pain perception. A review article published in the Journal of Headache Pain in 2008 explored the intricate interplay between serotonin levels and migraine susceptibility. Imbalances in dopamine have also been implicated in migraine. Hypersensitivity of dopamine receptors has been linked to certain migraine symptoms, such as yawning, nausea, vomiting, and hypotension. When it comes to neurotransmitters, keep in mind that in addition to the central nervous system, the gut also manufactures serotonin and dopamine. Therefore, gut health should be considered when addressing migraine. As another internal factor, inflammation is a key player in the complex landscape of migraine root cause analysis. The release of inflammatory mediators, such as calcitonin gene-related peptide, known as CGRP, during a migraine attack contributes to changes in blood vessel tone and generation of pain signals. Understanding and addressing this inflammatory component is crucial for developing targeted strategies for migraine. It reinforces the importance of adopting a holistic approach that encompasses nutrition and lifestyle modification to mitigate inflammation and elevate the migraine threshold. When it comes to identifying external factors that can tip the balance toward a migraine attack, food sensitivities, environmental triggers, and stress all need to be investigated. Common foods associated with migraine may include those high in tyramine or histamine, such as aged cheeses, fermented foods, alcohol, in particular wine or beer, processed foods, dried fruits, and certain fresh fruits and vegetables, such as avocado or eggplant. Excessive intake of caffeine that targets adenosine receptors on blood vessels may also be a common trigger for migraine. A variety of environmental factors may also contribute to lowering the migraine threshold. One very common environmental factor is the weather. Changes in barometric pressure, as can be seen with oncoming storms, excessive heat or humidity, and even bright sunshine are often linked to lowering of the migraine threshold. The air pressure changes associated with airplane travel or high altitude can also increase the predisposition to a migraine attack. Changes in a person's normal routine may also be triggers for migraine. The migraine brain loves regularity. Whenever there is a disruption in a person's routine, such as lack of sleep, jet lag, skipped meals, or dehydration, a person's migraine threshold will lower and increase the chances of an attack. Finally, in terms of the external factors for migraine, perhaps the elephant in the room is stress. Stress, with its physiologic changes in cortisol and hormone levels, plays a major role in lowering the migraine threshold. In summary, identifying and addressing both internal and external factors is crucial for effective migraine management, especially when using a root cause functional medicine approach. Now, let's explore how functional medicine can provide a personalized approach to tackle migraines. Functional medicine practitioners can use various tests to dig deeper into the root causes. Food sensitivity panels can provide valuable insights into dietary changes that might help. Identifying IgG and IgA antibodies against specific foods can guide a personalized elimination diet. One study even showed a reduction in migraine frequency and severity with this approach. Nutrient analysis allows us to pinpoint deficiencies that have been shown to be associated with migraine, like magnesium, the B vitamins niacin, riboflavin, and cobalamin, coenzyme Q10, and vitamin D. Tailoring a diet and supplementation plan to correct any nutritional deficiencies can make a significant difference. A comprehensive stool test explores the gut-brain connection, as gut health often plays a role in migraine. In addition to neurotransmitters secreted by the gut, like serotonin and dopamine, there is also early research investigating the connection between the gut microbiome and migraine. Gut dysbiosis may be a potential migraine root cause. Therefore, addressing gut health and promoting a healthy gut microbiome should always be part of a functional medicine approach to migraine improvement. Functional medicine offers a range of holistic treatments, starting with nutrition. Elimination diets, customized based on trigger identification, have shown effectiveness. The ketogenic diet, known for its neuroprotective effects, can be beneficial for some. Supplements like riboflavin and magnesium, feverfew, and coenzyme Q10 have demonstrated positive outcomes. Combining key ingredients in one supplement can simplify treatment for patients. Lifestyle factors such as sleep, movement, hydration, and most importantly, stress modulation are all modifiable approaches to migraine management from a root cause perspective. In summary, migraines are complex and multifactorial. By understanding an individual's genetics, hormones, neurotransmitters, diet, lifestyle, and environment, as healthcare practitioners, we can personalize treatments for our patients to achieve meaningful and long-lasting benefits. If you found this video useful, be sure to like and subscribe to the Rupa Health YouTube channel for more videos on root cause medicine. I'm Dr. Rudrani Banik, and thank you for watching.